So, if you were in this situation and you had both of your patients declining fast at the same time, I mentioned delegating. Use your coworkers. It is a team job to get someone fully resuscitated, so definitely use some delegation, have some people help you out. Personally, I can't remember any times that has happened, but I can tell you about a time where multiple people were doing bad on one floor all at the same time. So I'm on my lunch break. I come upstairs and there's a code going on. There wasn't a code before I left, and now there's a code going on. Okay, for context, I was working in the liver transplant ICU, and I've mentioned this before that a lot, I would say most liver failure patients, by the time they get to the ICU, they are very sick and they need CRRT or continuous dialysis. In a nutshell, you calculate how much fluid you're giving them in an hour, and then you are using the machine to pull it off them. And you go in and you run your numbers every hour. And we had just gotten so many people like fresh off orientation that were not yet trained in CRT on the machine yet. So our charge nurse was running like the entire front hall. It's probably like 5 or 6 CRT machines. Like that was their role for the night. And in the back hall, we had like more experienced nurses, a few machines, and we were all running those ourselves. And at the time of the code, all of the experienced nurses were in this room dealing with the code, including the charge nurse running all of those machines. And so I have my food that I just bought in my hand, and I go, like, set it down, go in the room, like, what do you guys need? What's going on? And they're like, okay, we got this covered, but there are 8 CRRT machines that have no one to run them. That's your job. You need to run those. And I know CRT, like I'm very comfortable with it, but 8 machines is a lot of machines and a lot of patients attached to those machines. And the very first patient, the very first machine that I go to, CRT, I go in the room and the patient's map is 36. 36. And I'm just like, are you kidding me? Like, I don't have time for this. Like, the fluid status and balance of liver failure patients is very sensitive, and a lot could go wrong. Like, I'm like hustling, like I'm going, and your map is 36. And nobody's here. It's just me. I mean, the people in the front, the new grads, but I'm just like, and the PA ended up coming, and I ended up running 7 machines or 8 machines for 4 hours. So that was fun.